So within the Tixel head, there's a little plate inside there that heats up to 400 degrees C. So the machine's just heating up now. We can control, this little plate will come and touch the surface of the skin, and we can control how long it spends on the surface of the skin, and therefore it will create a thermal injury, a fractionated thermal injury to the very surface of the skin. And if we want to really get the skin to change in a big way, so if somebody has acne scarring or very deep lines and wrinkles, then we can do a more ablative setting and hold the plate on the skin for longer, and that will result in greater changes to the skin, but equally there will be more redness and swelling, a little bit of downtime. The results from an ablative setting are often equivalent to a CO2 laser, which is the benchmark for skin resurfacing. But as many of us know, with CO2 laser, it's an extremely painful treatment, and the treatment has many weeks, if sometimes not months, of redness and downtime due to the trauma on the skin. And that's something we don't see with the ablative setting Tixel. Then the downtime is usually less than a week of some redness and dry skin. We can also set the Tixel to only even more briefly touch the skin, so there is absolutely very negligible downtime. But when that happens, it's called a mesotix, and it creates a thermal injury to the skin, but only enough to allow the skin to become temporarily porous for up to 6 hours, and that allows us to put any product or any hyaluronic acid, vitamin C, minerals, mesotherapy treatments on the skin following the mesotix treatment. The skin will soak that up like a sponge and will then start to heal and repair the skin very quickly. So in a mesotherapy setting, which is what we're going to be doing now, we can actually use it in a very different way, but to get the skin to glow, to new elasticity, new collagen formation, but in a much more gradual way than the more ablative setting. So it really is a versatile treatment. So it doesn't need to be as numb as when we do the ablative settings, and in fact you can do the mesotix settings without any anaesthetic, but it just makes it a little bit more comfortable. Okay. So, Kirsty, here we go, all right? Mm-hmm. So I'm just gonna start in a little area. Just a brief little, you feeling much?
Mm-hmm. Fine.
It's fine. Mm-hmm. Okay, so this little plate is touching the skin at 10 milliseconds. And we can even work on the eyelids. Very safely without any risk to the eye or the eyelid. And just working over the whole area. Now, eyelids are a really sensitive area, and how was that, Kirsty? Did you?
I noticed it more underneath the eye than I did above it.
Out of a scale of 1 to 10 of pain, what would you score it?
5.
Okay. And if we're in an area around here?
2.
Okay. So the eyelid is always a more sensitive area, but a tolerable treatment?
Definitely.
Okay. So mesotix like this, at this lower power setting, as you can see, there's a little tiny bit of redness coming due to the heat. The skin can feel warm as if you've had a very hot bath or shower, and maybe been out in the sun, strong sun. There is a smaller head that I can use if I need to work more intensively on the eye itself, which allows me to get much closer to the edge of the eyelid, but in Kirsty's case we're just doing a meso treatment. We're not doing the fully ablative resurfacing treatment, so we don't need that head. In the next few days, this redness will settle over the next few hours, and certainly by tomorrow there'll be really no redness at all. Over the next 6 hours following the treatment, the skin remains porous, so to speak, in that any products we want to put on the skin will be absorbed by the skin and have a positive benefit. So we often use hyaluronic acid in the pure form to hydrate the skin. We use vitamin C on the skin as an antioxidant, amino acids and peptides to help the skin regenerate and repair, thicken up and produce more elastin. If people have pigmentation problems, we can use topical agents that lighten the skin and reduce the effect of the melanin, so we can treat melasma and hyperpigmentation using this treatment. We can even use a peptide version of Botox to help soften wrinkles and lines, and so we can do a treatment very similar to having a Botox treatment but not actually having to inject Botox itself. So it's an incredibly versatile treatment. You can even take it a stage further and put PRP or platelet rich plasma onto the surface of the skin, and certainly if we're doing a more ablative setting, then combining it with PRP can be very effective in rejuvenating the skin, especially if somebody has significant acne scarring or very deep lines of wrinkles. And I'm now putting on a hyaluronic acid mask. All of that is going to get absorbed by the skin in the next 10 or 15 minutes. We'll keep that on, but how does it feel? It should be cooling thing.
Feels lovely.
Feels lovely, okay. So we'll leave you with that on for the next 15 minutes. Okay, and let all that absorb into the skin.